Hi everyone, I'm Dr. Abbas Ali, your orthopedics faculty with Maro. Today I have an amazing person with me. It's Dr. Dhruv. He's from Ukraine. His score is 243. It's an insane score, and you'll guess this. You won't be able to guess this. He scored 243 in his first attempt of appearing for FMG exam. Insane. Congratulations, Dr. Dhruv. It is an
Thank you,
awesome
sir.
score.
Thank you
I
so
mean,
much.
there are a lot of people I personally know who struggle to beat 150, and here you are in your first attempt, cracking 243. It's wonderful.
Thank you,
It
sir.
is it's a huge, huge achievement. You should be very, very proud of yourself, and this probably is that fundamental point in your life which will change your future because now you know that you can do something so great. Awesome. So, can
Yes,
you
sir.
tell us about yourself? Where are you from? Where did you do your MBBS? Which country are you from in terms of your preparation in MBBS?
Yes, sir. So, sir, I'm from Rajpipla, which is in the state of Gujarat, and I have done my MBBS from Bukovinian State Medical University, which is in Ukraine, and I am from 2016 batch.
So, you joined MBBS in 2016 batch. Awesome. Okay.
Yes, sir.
So, when did you start using Maro?
Uh, I started using Marrow 2 years back.
Two
Two
years
years
back, matlab
back,
in
and
2020?
in my fifth year, sir. Yes, 2020 beginning. I got a reference from my friend, and I really liked the. I first saw the pharmacology videos, and then I knew that I had to get marrow. So it became since then it became my source of preparation.
So it's roughly 2 years since you've been using Maro,
Yes, sir.
and within 2 years, you have managed to score such an amazing score of 243.
Yes,
All
sir.
right, let me ask you, how did you go about doing this? How did you start your preparation with Maro, and when did you realize you actually needed Maro?
Uh, well, I started, like in the mid fourth year. Ever since the COVID struck, so I was, like getting hang of thing. Like now, I have to be, consistent in making my notes and
What
everything.
happened when COVID struck? What happened? What you came back
I
home
was
or
in
were you stuck
no,
there?
no, I was in Ukraine only.
Okay.
So yeah, then I realized that now, like the exam is getting closer, and I need to do something about it
नहीं,
because
आपके एग्जाम को कितने दिन थे? I mean, you were in Ukraine, that is
uh,
2020. You were
two
up
and a
for,
half years, sir. Two and
so
a
you
half
had two
years.
and a half years, ना? तो काफी time था ना?
Yes.
What made you decide to take Maro then and there?
Because well, we do not have clinical exposure as needed in the foreign countries, and even if there is a barrier of foreign language, so it's very minimal. And to me, my first exposure to many of the subjects was marrow. So yeah, I was getting to know the subject since to marrow only because I did not read much of a standard
If that is
textbooks.
the case, who would you consider as among your favorite faculties of Maro?
So my favorite is I would name three. First is Dr. Rohan sir, then Dr. Sakshi Arora Hans ma'am, and then sir you. Your orthopedic videos are gold. So yes, they are
I mean,
incomparable to
I
anything.
can vouch for this fact. Dr. Rohan's surgery is amazing and he simplifies it
Yes,
so very well, especially for FMG students who find it very difficult to grasp it.
yes sir,
And Sakshi Arora, madam's Obs and Gyne, I think it's the gold standard. Everyone,
yes sir,
whether you're preparing for INI set or NEET PG and
yes sir.
FMG exam, that is a go to. But you saying that orthopedics was so nice from is it's wonderful.
Of
It's
course sir.
so nice to hear that. But एक बात बताओ मुझे. Okay, so ये
Yes
तीन
sir.
टीचर को तो आपने सुना, you have heard about this, and then you've picked
Yes.
up Marrow and you started using it. Can we just understand how did you start using it? Because Marrow has videos, has question bank,
Yes sir.
has tests, has mock exams, has pearls, has so many things. You as an undergraduate in a foreign country, how did you start using it for your exams as well as FMG exam?
Uh, for me, the basic goal was like I would see the videos first of a particular topic, and on the same day I would solve the Q bank. And of course, I was making notes for most of the subject as well. I was seeing the videos, and then I would solve the Q bank, and that was my approach for every subject. And as the exam came closer, I started giving GTs and all. So
Okay,
that
so
was for the later part.
you would watch a video, make notes as much as possible by yourself, खुद से, and
Yes,
then
sir.
do the question bank
Yes,
of
sir.
that particular module that you've watched. Now, by
Yes, sir.
doing this, you must have taken a lot of your time for a
Yes, sir.
subject. Now, would you still go ahead and read a textbook or any reference book? कुछ और करते थे क्या?
Sir, for me, I would not refer a textbook, but then whatever question I get wrong, or if I don't know anything about the context of the options, I would just read the explanation beneath every MCQ the Marrow has, because I think Marrow would cover every topic beneath the MCQ as only. So I don't think there is any need to go anywhere
More.
else if you
I
have.
understand.
So I
Understand.
would,
Right. I understand. And now tell me, I mean, by using this, was this helpful for your final exams also, your professional exams, your MBBS
of
exams?
course, sir. Of course, it was helpful because the concept would remain the same and the questions they remain the same. It would be just the way of asking. So I don't think it matters really.
Okay. That's reassuring because a lot of students sometimes feel that the content is enormous. They feel that. I mean, what do you have to say about that? आपको कैसा लगता है?
Uh, well, I say content is enormous, but then once you see it, you have a craving for it. For me, like I would want to see the content because I know it's vast, but then once you get the grasp of it, I think you want to see it because you understand in a way that nobody does. So that concept still instills in your mind. So I think it's better to see the vast content in the
I
first
mean,
place.
yeah, that is what it's like reading a book where you have the
Yes,
complete
sir.
story instead of just
Yes, sir.
watching a movie of it, right? But
Of
वही है ना,
course.
you get the complete picture, and that is what sets you apart compared to other students or
Yes.
other people. It sets you apart. You're at a level where your score speaks itself. Na? 243 is no joke, right? Now, let me ask you this. You would watch the videos, make the notes, and do the question bank, right? So, can you
Yes,
just
sir.
walk us through how you would do the question bank? What would be your average scores in the question bank?
Sir, my average score would be 70%, 75% on an average. And yeah, that's how I would do. And any topic, if I don't know any topic or some question is new, I would just write it in my notes there and then so that
Right.
the next
So
time I have
question
it.
bank भी दो ही है ना. I mean, there are two types of question banks we have in our Marrow. We have the NEET PG ionized set question bank with all the information, and then we have a specific FMG question bank with concise information focused for FMG exam. What would you have used when you were preparing?
Uh, Sir, for me, I used the PG side of the question bank from the beginning, and I stuck to that only since the last. But then for the last leg, I had to do previous year questions. So then I switched to FMG portion 3 or 4 months back before the
Okay.
exams.
So when you switched to the FMG question bank, did you notice a difference?
Yes, sir. I did notice a difference. It was it was very selective, and it was something that only an FMG needs for the exam. And I think it was better for the FMGs. And yes, it was very concise information. I loved that as well.
That is very important because you see, there is it is an easy job just to copy and paste a question bank and rebrand it as FMG
Exactly.
question bank, right? You
Exactly.
have to understand that effort was put in to actually select the
Effort was
topic,
definitely put in. Yes, sir.
to pick the
And
topics where our FMG students struggle.
yes. And it was the specific topics, specific points that we need to know. In the FMGs, it was very beautiful question bank. I loved it, but it was late in my leg of preparation, so it doesn't matter. But since if you have to make notes for the previous year topics that I made, uh, so they were gold for
So
the
no,
Marrow Q
if
bank.
no, आपका तो हो गया. You have done it. If you
Yes.
can advise your juniors, people behind you, to follow question bank for FMG exam, what would you recommend?
For FMG exam, I would definitely recommend the FMG portion of the question bank only for me because that's something you exactly need. And of course, team has put an enormous effort in like filtering out only the information that you need. So I think it's better to follow that question bank
Yeah,
for the
it is
particular exam.
essentially selection of topics that are frequently asked in the
Exactly.
exam, relevant for your exam, that will give you a higher probability of cracking the
Yes.
exam.
Repeat.
Right. The
Yeah.
whole point of
Yeah.
FMG exam is to be able to crack it. You don't have to ace it. You don't have
Exactly.
to compete with anyone. You have to crack it. And many
Yes, sir.
students, I find, struggle to crack that 150 mark, and they fail just by few marks. And I think focusing on things that are relevant to them is something that is usually
Yes, sir.
missed. And if you do the
Yes, sir.
FMG question bank, that will solve your issues. Now, coming to tests, Dhruv, tell me about tests. When would you take the grand tests? And what was your frequency? And what kind of results did you expect and you actually got?
Sir, I would appear for the grand test there and then whenever it was live from the Marrow. So yeah, I think monthly would I would give grand test monthly, and then the result was average was it was 230 up, 230 plus I was scoring in
So did you
everything.
give FMG specific grand test, or did you again give general grand tests?
Well, for the grand test pertaining to FMG for the last 3 months, yes, I was giving only FMGs, but during my leg of preparation, I was giving PG tests as well, grand
So
tests.
again, did you notice any difference?
Yes, enormous difference. The level of questions and the information they ask. The topics are a bit different, but then, yeah,
Yeah, I
it's
mean,
the
that
difference.
is the whole point. And the point is to sharpen you for an exam
Yeah.
that you're going to appear for. Although a lot of people say that the board is the same, the exam is the same, the topics are the same, the content is the same. I mean, I agree, it is, but there is a world of difference in terms of what you have to do with the exam. For an
Yes,
entrance exam like NEET, PG, or INI set, you need to compete with others. You need to outdo
exactly.
the others to be someone better than them. But here, you just have to outdo yourself and improve yourself peacefully and patiently. And for that, you need to be smart to focus on things that are going to be asked on the exam. And that is what the FMG grant tests are asking.
Yes, sir.
What about the mock exam? Did you appear for the FMG mock exam that we conducted?
Yes, sir. I did.
What was your score in that?
So the last mock, 258.
Oh, so वहाँ पे 258 आया, यहाँ 243 आया. What do you think? How close was the representation?
Of course, it was close, sir. I was, like I was watching the interviews of the previous toppers, and they would always say that the marrow mocks always, it mimics your real exam score very closely. And now I can definitely say it does.
A lot of people say it is magic, it's wizardry, but it's not. It's science. It's based on algorithms. It's based on what are the
Exactly.
questions and the topics that are asked, and that's how we create those questions, and it shows up on your mock. Anyways, for FMG friends, because there are certain times, in a different time zone, struggling with different subjects, we have these live webinars that we conduct over the year to coach them, to mentor them, to guide them individually, and we have these live sessions that we conduct. These are closed sessions specifically for FMG students. Did you happen to attend any of them, and were they useful to you?
Yes, sir. I did attend surgery once. Dr. Rohan Khandelwal sir used to conduct, and I think I was in every one of them. I attended.
Awesome, awesome. Did you find it useful?
Of course, sir. To make a strategy, and it's not about reading something, but it's more about how you will read that in the last 15 days. So it's always about it, and to get the strategy from someone who knows the best. So it's amazing.
I mean, I love what you have said it, and maybe probably many people have not paid attention to what you've said. It's not about studying; it's about how you plan to revise. That's a
Exactly,
wonderful
sir.
thing to say, because you can read anything, you can read as much as you want, but if you don't revise it, there is no point, because exam में जाने से पहले revision ही important है, right? And
Yes,
so
sir.
whenever you're preparing, your whole strategy should be aimed at how you're going to revise that. If it's something you can't revise, don't
Exactly.
read it. Right?
It
Any
it's
particular
useless.
hobbies that you have apart from studying so well and scoring such great marks?
Sir, I love playing badminton in my spare time.
Awesome.
Yes, sir.
So this war effect on Ukraine, what kind of impact did it have on you in terms of your preparation, in terms of your medical school life, in terms of your career?
Well, the war when the war struck, luckily we were in the final year, and we were finishing all of the stuff. And yes, except for the graduation, everything was finished. So we were about to come back, and we came back. I think 3 or 4 days after the conflict happened, and it did make a psychological impact on us. We were worried about our diplomas or the degrees, how they will come and what is going to happen. So there were some uncertainties, but nevertheless, it was not in our hands. So it was not something that we could do anything about. So I just personally continued to read, and that's what I did.
Now, Dhruv, I want to ask you, because there are a lot of students who can't go back to their medical schools because of travel restrictions, and certain students who are stuck in the conflict zones are getting transferred from one university to another, particularly FMGs. I just want to know, what were your personal things that you did. Tell yourself, and do meditation or exercise or something that you did yourself to calm yourself down, to reduce the stress and anxiety that you would face in these kind of situations.
So whenever like I was feeling low, I would just take a walk, take a walk and just need to calm down. And whenever I was feeling low, I would just stop reading that day for that part of the day because there was no use. I could not concentrate. So I would just take a walk and then have a nice dinner, and that call it the end of the day. But from the next day, I made sure I make a good start and start again. So that's something I needed to
It's
do.
easy to tell कि ना पढ़ते जाओ करते जाओ, वो नहीं हो पाता है ना. I mean, there is a
नहीं
time when
होता.
you break,
Yeah.
so you have to take a break.
And you need to think, like you need to think why you actually started. Think about your parents, what they did and what they did for you, like everything. And that acts like a pump or a boost for you to start very fresh the next day, and it
I'm
helps
sure
really.
your parents must be so happy and so proud right now. Your score 243 is no joke.
Yes, sir.
Right. So how did you convey this to them? Because they will probably not understand the intensity of the gravity of the situation of 243 score. उनको समझ नहीं आई होगी ना. आप how did you explain this to them? It's like getting like top 1,000 rank in NEET PG. वैसी बात है. Did you explain that to them?
Sir, yes, they don't. I mean, they don't know the intensity, but then, whatever from the beginning, they had trust in me. They had supported me in everything I did. So, they had trust in me. So when I let them know, so they were very happy, ecstatic, as I was, and my mother was very happy when I called her and told her this.
No, it is wonderful because a lot of times what happens is students at such a young age when they go abroad, they are misguided, they lose track, they lose focus, they start failing, and it's a cascading effect, and they stop preparing, they
Exactly.
give up. It's so wonderful to see you complete the whole circle of preparation with such a high score. Is there any particular advice that you would give to your juniors who are behind you to complete this circle and finish what they started before going to foreign country?
Well, for the college life, I would say there needs to be a balance. There needs to be a balance. I mean, you can go out and do anything you want, but there needs to be a time in a day that you have to study. You have to give yourself targets that I need to finish this and then I can go anywhere I want or do anything I do. So that's something I used. So whatever I had to study, I would study in that day, regardless of what would occur, and then do anything else. So I think there needs to be a balance, and give yourself a day off in a week, so that would not hurt. So yeah, keeping a balance helps.
What about in terms of Marrow? Would you advise your juniors to just take a look at
Exactly.
it, or how to use it, or would you recommend it to your juniors?
Well, there's not a single feature of Marrow that I do not like. So yeah, it's a whole medical school in itself, I would say, because you have everything that you need for the exams, for the subject that you want to read, and the content it has is it's just gold. I cannot compare it to anything else, sir. So I would
It's so
definitely
wonderful.
recommend it to my juniors.
It's so reassuring. I mean, all the teachers on the platforms put their heart into it, and when someone like you says ki it is gold standard, it's just amazing. It was so
Exactly.
nice talking to you, Dr. Dhruv. Your score is such an amazing score. With this momentum, what is your future plan now? I mean, इतनी पढ़ाई तो कर ही लिया है, इतना अच्छे marks तो ला
Yes.
ही लिया. I mean, what is your plan now? What do you want to do with this in the future?
Sir, I want to, of course, pursue PG after this, and I would continue to read and study this so that I can achieve that. So I would not stop right here.
Right. I'm looking forward to interviewing once again when you crack your NEET PG exam and or INI set exam and get such an amazing rank. Hopefully, I wish you all the best, and I'm so
Thank you,
happy
sir.
that we played a small part in your success.
Sir,
Thank you.
it's my pleasure that I'm in front of you right now. It's like a
Uh,
dream come true for me.
thank you. Thank you. Have a great night. Bye bye.
Thank you, sir. You too. Bye.